Hi guys, this is Jonathan Yerasimides. I'm an orthopedic surgeon at Louisville Hip and Knee Institute. I'm a specialist in hip surgery, specifically hip replacement, and just wanted to go over a little bit of the general anatomy of what the hip actually is. So the hip is a general term. It's not a specific bone, it's a general term about a joint in our body. And that joint is a combination of the femur, which is your thigh bone, and the top of the femur, which is the femoral head, combined with the acetabulum. The acetabulum is just a fancy term for the hip socket. Now the hip socket is part of the pelvis. So looking at this x-ray, you would think that the pelvis is a two-dimensional structure, but in reality, when we look at the pelvis from an x-ray standpoint, we're looking at it tilted. The hip joint is closer to the front of your body than it is the back of your body, which confuses some people in realizing when they have hip pain. Most people think their hip is hurting when the side of the hip is hurting or their buttock are hurting. And it's actually the opposite. Those structures, the side and the posterior buttock, are farther away from the hip joint than your groin. Whenever you start to feel groin pain or feel like you may have a groin pull and feel some resistance to range of motion, or maybe it's hard to get a sock and shoe on, that's a sign that it's actually your true hip joint. Because the pelvis is tilted forward, the hip is very close to the front of our body. On most people, the hip isn't more than 2 to 3 inches below the skin on the front of our body, and so the pain is felt in the front. It's part of the reason why anterior approach hip replacement was created, because it's easier to get to the hip joint from the front than it is to get there from the back. So if you're feeling groin pain, if you have limited range of motion, socks and shoes are getting a little harder, or maybe crossing your legs is getting a little harder, that might be a sign that your hip is the problem. Now, when we look at the x-ray, and if you say you come to my office and you say I'm having hip pain, we'll get an x-ray similar to this. Now, how do we determine on an x-ray that somebody has arthritis? And what is arthritis? Well, arthritis is a very generic term. Technically, the root of the word means joint inflammation. That's all it means. We use the term to describe conditions where there is cartilage loss in the joint. That in turn causes inflammation of the joint, which can cause bone spurs to form, which then causes limited range of motion. When we look at this x-ray, and we always look at these as if you're facing us, that's another thing that confuses people initially. This is the right side, this is the left side. We always look at the x-ray as if the person's facing us. So if we look at this person's left side, we see the ball, the socket, and you see an empty space between the ball and socket. Well, that's not empty space because it's an x-ray. X-rays only show us bone. They don't show us the soft tissues. Your skin, your muscle, your guts are all invisible. Well, cartilage is a soft tissue, so therefore it's invisible. And what you see is an empty space. The larger and more concentric that empty space is, the more cartilage you have. If we go over to this person's right joint, you see ball, socket, and you see they're touching. And that's where this general term of bone on bone comes from. Because the cartilage has been lost, therefore the ball and the socket are touching each other, and that's what causes pain. Well, why does it cause pain, you ask? Well, because cartilage doesn't have nerve fibers. When cartilage rubs on cartilage, like say your fingers or your elbows, you can't feel it. You can't feel your joints move. But bone has nerve fibers. We all know that if we break a bone, it hurts really bad. So when the cartilage is lost, and now you have bone touching bone, Now you feel every motion of your leg, and you especially feel twisting motions of the leg. And so that will be felt in the groin area. It can radiate down the front of the thigh and even into the knee. But the x-ray, the simple x-ray in the office, gives us very good information, and 9 out of 10 times gives us all the information we need to know that you might be a candidate for a hip replacement. So if you guys think that you may have a hip problem, or just want to be evaluated and have an x-ray done so that one of us can go over it with you and see if there's anything going on, please give us a call at Louisville Hip Knee Institute, and we'd be glad to see you take an x-ray and check it out. Thanks, guys.